Matter of time before the COVID vaccine is here and preparedness happening in full-fledged. I have with me Dr. G. Srinivas Rao, who is the Director of Public Health for Telangana. First of all, I'm going to ask Nagaraj to pan so that we can show the COVID war room, which has now been converted into a state control room for vaccinations. So what kind of preparations are happening? When are you actually expecting this to roll out? The rollout to happen, you're talking about 1.6 crore doses that Telangana could get. What is the basis on which this number is arrived at?
Yeah, actually, last 10 months we are all fighting against this pandemic with the support of the public and the state and central governments. We were able to control the pandemic in the state. Now it's a turn to a vaccine, COVID-19 vaccine, and in world most of the countries has already initiated the vaccination program. As far as Telangana and the central government is concerned, we got the instructions from the union government to prepare ourselves, to gear ourselves to introduce the vaccine in the state for the targeted beneficiaries. So in the first phase, we are going to cover 4 categories of people. That is, the first one is front-line healthcare workers. Almost in Telangana, we have around 3 lakh healthcare workers, both public and private hospitals.
These are doctors, nurses, technicians, what boys?
And up to ASHAs.
Up to ASHA workers.
Up to ASHA workers. Everybody will be covered in both private and public health facilities. So that enumeration is already done. There is a software called CoWIN. We are uploading the entire beneficiary information on the portal. So that's one part. And the second part will be other frontline workers from the line departments like police department, then the municipal administration department of sanitation workers and the defense services. So that's as part of the first phase, the second group will come into picture. The third one will be the above 50 years. Almost in a general population, around 18% population will be there, belongs to the above 50. Then the below 50, the people who are suffering with comorbidities, normally 2 to 3% will be there. So there is an estimation of around 80 lakhs of the beneficiaries in first phase, which we are planning to cover in the with the COVID-19 vaccine.
Optimistically, can we say January, mid-January is when the rollout may actually start happening? And how long will this 80 lakh people, how long do you think the time will take for covering all of them?
Yeah, it's definitely a mammoth task, but the state government and the country is having experience in conducting these kind of campaigns earlier. For example, in Telangana state itself, we have conducted measles and rubella campaign in the year of 2017, where we have covered almost 25% of population in our state. So that means a crore of population has been covered within a span of 2-3 weeks. So we are having 10,000 vaccinators across the state, that is from the government system, public system. We have not included the private vaccinators too. So now in the coming days, we are planning, as and when we receive the vaccine, within hours or within few days, we can roll out the vaccine, and if we could able to get the required quantities, we could able to cover the entire first dose within 8 to 10 days. So wow. we are gearing up such a way. Okay.
And so do we have the healthcare professionals who are trained to do the inoculation? It would be an injection presumably.
Yeah, most of the states are having a very good experience in conducting the immunization program. Our routine immunization program is a robust program, and already we are giving the vaccines for against 13 antigens. Okay, so as far as we are hoping that this will be given in intramuscular form, where the temperatures also will be maintained between the 2 to 8 degrees centigrade. So we hope that we are having the enough infrastructure, and now without much disturbance to the routine immunization program, we are adding additional storage facility at the state level. We are adding where we are planning to keep 2 more crore doses at the state level, and regional vaccine stores. Earlier we don't have regional vaccine stores. Now we are establishing 10 regional vaccine stores exclusively to store the COVID-19 vaccine, where we can store around 1 crore doses. So that means 3 crore doses where we are going to store at the regional level and the state level. And in addition to that, more than 1,000 facilities are there where we have walk-in coolers and other equipments at the state level. So now we are having sufficient space with related to the storage, and also the entire logistics and other will be maintained.
So you're saying both in terms of the human resources as well as infrastructure, cold chains, the transport, maintaining the cold chain, all that is still already in place.
Already in place, and we are now acquiring certain additional walk-in coolers also, and also for the transportation facility, we are having 50% of vehicles now. Each district, because so many new districts have formed in Telangana state, now we are providing one the vaccine transport van to each district. That procurement is also processed. So everything goes well, by end of this month, and all these things will be in place, and as and when we receive, we are ready to go with the shots.
What are the specific challenges of what you expect could be there in a COVID vaccine?
Yeah, COVID-19 vaccine being a new vaccine, okay. So normally in public health, we'll see a most effective and safe vaccine which will take almost 5 to 10 years. That's the minimum period, okay. Now with this pandemic, the way people are getting the disease and where so many lives are losing. So within 1 year, we could able to come out with a most safe and efficacy vaccine, and the information which we got is definitely it's not going to have more adverse events, but we are geared up to tackle those things also. At each session site, AEF adverse events following immunization management kits will be there, will be provided. If any serious adverse events are there, the target facilities will be there either in teaching hospital or district hospital. Vehicles, 108 vehicles will be placed in the strategic locations. We hope that because in the normal routine immunization program also there will be small adverse events will be there, that will be managed and subsided at that session site itself. So in any case, we are geared up to tackle those things also, but ultimately that being a new vaccine, there will be so many myths, so many apprehensions among the people. Now the risk communication is also going to play very important role. Anyway, media is playing very vital role, both electronic and print media, and from our end also the risk communication is another important thing. The government of India, state governments are coming out with different modes of communication to reach the public, and in Telangana state, under the as per the directions of Honorable Chief Minister K.C.R. Garu, the different committees have been formed at different levels. There is the first level is chaired by Chief Secretary, the state steering committee is there, Health Secretary chaired by state task force committee is there, and the district level district collectors will chair the district task force committees are there. Even Mandal level also we are having Mandal task force. Apart from this, compared to other states, we plan to involve all the public representatives, okay, from the district level, from the urban local body level, then the Mandal level also. All the public representatives will be included in the committees as per the directions of our Honorable Chief Minister, especially to create awareness, to have some kind of coordination with the public representatives, with the public and the officials.
So very optimistically, if January 15 we get it, within 2 weeks we should be able to cover the 80 lakh people. And then again the next dosage in about 4 weeks time is what the understanding is as of now?
Absolutely. As of now, that's the thing. In the mid of January, we are hoping that the vaccine program will be rolled out, COVID-19 vaccine, and within few days, as and when based on the number of dosages, we will plan. As I told, we are ready to cover entire 80 lakh benefits with the first dose, minimum of 8 to 10 days.
Okay, thank you so much.
Thank you so
Dr.
much.
Srinivas Rao. So, on an optimistic note, what is considered Sankranti and Pongal in these parts, that's when we are hoping that the rollout of the vaccine will actually start, and within a couple of weeks, the director is confident that the first dose will be over, and then within 4 weeks again the second dosage. In Hyderabad, with camera person Nagraju, Uma Sudhir, NDTV.